We're gonna do our room scan. Hello, I'm Shpressa, I'm the recorder.
Knock, knock, knock. I will wash my hands. Hello, my name is Sirapon. I'm your nurse today. I'm going to perform physical assessment on you. Is that okay? Can I see your ID band, please? Can you tell me your name? Your date of birth? Okay, they match. The patient is 50-year-old and appears state-age. He is smiling and shows no sign of distress. He exhibits calm and cooperative behavior. The patient is awake, alert, and oriented. He is able to state who he is, where he is, the current date, and the reason he is in the hospital with clear speech. And the patient appear freshly showered and well groomed with neatly combed hair. The patient is lying mid-lie in bed and displaying no sign of discomfort and abnormal positioning. He is without the use of assistive devices and he can get out of bed on his own. There are involuntary movement observed. The face and the body are symmetrical. And next I'm going to do the vital sign. I'm going to pull down the gown and check apical pulse. I'm going to place my stethoscope on the fifth intercostal space at mid-clavicular line on the left side of the sternum. I got 60 beats per minute, regular rhythm and 2 plus force. And next I'm going to check the radial pulse. I'm going to place my 2 fingers over the radial artery. And I got 60 beats per minute, regular rhythm and 2 plus force. And next I'm going to check his respiratory rate. I'm going to look on his chest, breathing in and out, and I got 16 within normal range and the regular rhythm. And next I'm going to check his pulse ox on his finger. And I got 96% within normal range. And next I'm going to check his blood pressure. And I'm going to place my stethoscope over the brachial artery. And then I'm going to inflate the cup and deflate and read the meter. I got 120 over 80 millimeter of mercury within normal range. And next I'm going to check his temperature. The temperature can check many methods, including oral temperature. Is appropriate when the patient is conscious and able to cooperate and can close the mouth around the thermometer. And it is important to ask the patient if they just ate or drink in the last 10 minutes because it can affect the accuracy of the reading. And the tympanic temperature is used when the oral temperature is not possible, such as the patient just ate or drank. And the rectal temperature is one of the most accurate temperature. It is used when the patient has neurovascular disease or some type of surgery that require the precise temperature. However, it can discomfort the patient. And the tympanic temperature is used when the patient just ate or drank or cannot close their mouth around the thermometer. I use the oral temperature for my patient and got 98.6 degree Fahrenheit within normal range. And next I'm going to assess his head. His head is normal in shape and the facial features are symmetrical. The lip and the face color are normal for his ethnicity. The facial texture is smooth with no lesion and the lip texture is smooth without any dryness or crack. His scalp appears clean without free of lesions. The hair is well groomed with no sign of dryness. dandruff or damage. His neck is symmetrical. The shoulders are even. The trachea and substernal notch are also in midline. And I'm going to palpate his head to assess for any masses or tenderness, and none of them present. And next I'm going to palpate the carotid artery. I'm going to palpate one side at a time. And they have PAL criteria of 2+. And next I'm going to palpate the lymph nodes. I'm going to tell the patient, I'm going to check your lymph nodes, and can you move closer to me a little bit, and you just relax, okay? You are going to feel I'm pressing. I'm going to palpate occipital at the back of your head. I don't feel anything, and the patient denies discomfort. And next I'm going to palpate behind the ear, behind the auricle, at the soft tissue pocket, and palpating post auricular. I don't feel anything. The patient denies discomfort. And next I'm going to palpate in the front of the trachea at the soft tissue pocket, pre-auricular. I don't feel anything, and the patient denies discomfort. And I'm going to move my hand down, my finger down like triangle, and I'm going to palpate tonsillar under the mandible. I don't feel anything, and the patient denies discomfort. And next I'm going to palpate under the mandible at the soft tissue pocket, submandibular. I don't feel anything, and the patient denies discomfort. And I'm going to palpate under the chin at the soft tissue pocket and palpating submental. I don't feel anything, and the patient denies discomfort. And next I'm going to locate the major muscle of his neck, and I'm going to palpate at the back of that muscle. I'm palpating posterior cervical. I walk my finger up and down, and I don't feel anything, and the patient denies discomfort. And I'm going to move my finger in the front and walk my finger up and down in the anterior cervical. I don't feel anything, and the patient denies discomfort. And I'm going to explore the clavicle, and I'm going to palpate above the clavicle at the soft tissue supraclavicular. I don't feel anything, and the patient denies discomfort. And next I'm going to inspect his eyes. They position midline, and the pupils are aligned in the center. The eyebrows are even. There is no ptosis or abnormal eyelid placement, and the lacrimal drainage, there is no crusting, no discharge. And I'm going to pull down the lower eyelid and check for conjunctiva, which is pink, and the sclera is white. And next I'm going to dim the light, and I'm going to shine the pen light into his eye to check the pupils reaction. And I'm going to turn the light back on. I'm going to have the patient look on my pen light. Can you follow my pen light, please? The pupils are equal, round, reactive to light, and accommodating bilaterally. And I'm going to assess the extraocular movement. I'm going to have the patient follow my pen light in cross pattern. Can you follow my pen light without moving your head, okay? The patient is able to perform and follow my pen light smoothly in all directions. And next I'm going to assess his ear. I'm going to palpate the auricle and labio. I'm checking for any lesions. There are no lesions present, and I'm going to shine my pen light into the ear canal. There is no drainage, and I'm going to press the tragus and ask patient, do you have any pain? I'm pressing here. Patient denies pain, and I'm going to move to the other side of the bed to check the other ear. I'm palpating auricle, labio, and check for any lesions. There are no lesions present, and I'm going to check into the ear canal. There is no discharge. I'm going to press the tragus. Patient denies pain, and I'm going to check if the patient can hear me in our conversation. The patient is able to respond to me appropriately, indicating his hearing is normal. And next I'm going to assess. I'm going to assess the auditory acuity, and I'm going to stand a short distance away and have the patient close one ear, and I'm going to whispering something like a word, and then the other ear, the patient is able to answer the word I whisper, indicating both ear can hear clearly. And next, I'm going to assess his nose for nasal patency and pharynx. I'm going to have him to close one nostril and breathe to the other to check for any obstruction and assess the pharynx, which indicate the difficult breathing, and I'm going to check the nasal septum for deviation and the mucous membrane. The nose is patent bilaterally, no flaring observed. The nasal septum is midline, no deviation. The mucous membrane appear pink and moist. Okay, and next I'm going to assess his mouth. I'm going to look for buccal and sublingual mucosa. They appear pink and moist, and I'm looking for soft and hard palate. They are intact and symmetrical, and I'm going to use the tongue blade to look the uvula, which is midline and rise when the patient say and I'm going to look at the back of his throat, both sides, looking for tonsil, and they are not enlarged, and the teeth and the gum are good condition, no decay, no loose teeth, and no danger. Okay, and next I'm going to assess his active range of motion of his neck. I'm going to ask the patient to move his head from side to side, up and down, and then I'm going to place my hand on one side of his head to apply the slight resistance and ask the patient move his head against and this side. The patient is able to perform this movement, indicating he has normal active range of motion of his neck and the muscle strength. And next, I'm going to assess his mode of breathing. He is breathing through his nose, and I'm going to assess for the use of accessory muscle. He not using the shoulder or the abdomen for breath, and there is no visible of the use of accessory muscle, no rib retraction or popping out during respiration. And next, I'm going to observe I don't hear any cough or there is no sputum, and I'm going to and the patient is able to breathe comfortably in supine, prone, and upright position. And I'm going to check the jugular vein distension. To assess this, I'm going to have the patient lay flat, and then I'm going to raise the base of the head 45 degrees. And I'm going to observe the jugular vein, and he has no jugular vein distension. And next, I'm going to assess his chest. The chest is symmetrical, and its configuration is normal for his body shape. And next, I'm going to check for extremity. The extremity has normal color for his ethnicity with normal hair pattern, no deformity, and I'm going to check the condition of his fingernail. And then I'm going to check the capillary refill. I'm going to press each nail, and they are returned pink within 2 seconds, which is normal capillary refill. And I'm going to check the toenail for condition of toenail, which is normal, and I'm going to check the capillary refill of each toenail, and they are normal capillary refill. And I'm going to do the other hand. Okay, they appear return pink within 2 seconds and indicating normal capillary refill. And next, I'm going to lower his gown, and I'm going to palpation, light palpate on his chest to assess the masses, tenderness, and crepitus. And I'm going to palpate laterally and posteriorly, and none of them present. And next, I'm going to palpate the cardiac landmark, starting from aortic area, second intercostal space on the right side of the sternum, and then pulmonic area, second intercostal space on the left side of the sternum, a point at the third intercostal space on the left side of the sternum, tricuspid area, at the fourth intercostal space on the left side of the sternum, and mitral area, at fifth intercostal space at mid-clavicular line on the left side of the sternum. And there are no hips or lip were detected. And I'm going to assess his chest expansion symmetry. I'm going to put my my hand over his chest, and I'm going to ask the patient to take a deep breath. My hand move equally, indicating symmetrical chest expansion and normal depth. And next, I'm going to auscultate his lung lobe, all 5 lobes, 3 on the right and 2 on the left. And I'm going to do the anterior, lateral, and posterior aspect. And I'm going to use the ladder technique and I'm going to start from place my stethoscope or above the clavicle and have the patient breathe every time I place my stethoscope. Okay, breathe, 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 and laterally breathe and breathe, 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 and posteriorly as well. His lung sound will clear in all areas, anteriorly, laterally, and posteriorly. And next, I'm going to auscultate the heart sound or the 5 cardiac landmark. I'm going to start from the aortic area, the second intercostal space on the right side of the sternum, and slide my stethoscope to the pulmonic area, second intercostal space left side of the sternum, and then a point third intercostal space on the left side of the sternum, and tricuspid area on the fourth intercostal space on the left side of the sternum, and lastly mitral area at the fifth intercostal space at mid-clavicular line on the left side of the sternum, and no abnormality of the heart sound were detected. And next, I'm going to put the card. Next, I'm going to check for the extremity, check peripheral pulse. I'm going to start from the radial pulse, and they have pulse criteria of 2+. And next is the femoral pulse. They have pulse criteria of 2+. And popliteal pulse, they have pulse criteria of 2+. And pedal pulse, they have pulse criteria of 2+. And posterior tibial pulse, and they have pulse criteria of 2+. And the temperature of all extremity are warm. And next, I'm going to check his abdomen. I'm going to pull down the gown, and I'm looking for his abdomen for contour and symmetry. It's flat and both sides are equal, and I'm looking for pigmentation and coloring is even, with no changes in pigmentation. And I'm looking for pulsation, that I don't feel any pulsation. There are no scar or striae present, and I'm looking particular, there are none present, and I don't observe any masses or bulges, and the umbilicus is midline. And next, I'm going to auscultate the bowel sound. I'm going to listen for each quadrant for 1 full minute. If I got 5 to 30 active bowel sound, I move to the next quadrant. If not, I will listen up to 5 minutes. Okay, start from the right lower quadrant, got 15 active bowel sound. Right upper quadrant, 15 active bowel sound. left upper quadrant 15 active vowel sound and left lower quadrant 15 active vowel sound. So he got normal active vowel sound for all quadrants. And next I'm going to light palpate for each quadrant, and I'm going to looking for the masses, tenderness and pulsation. I'm going to start right lower quadrant with my one hand, right upper quadrant, left upper quadrant and left lower quadrant. Okay, there are none of them present. And next I'm going to check his genital area to make sure he has healthy tissue. The tissue is healthy. The color is normal for his skin tone. There is no lesions and no discharge. And observe his urine, which is straw color and clear, and the stool is brown in form. And next I'm going to assess the musculoskeletal system. I'm going to assess his skin color. His skin color is normal for his skin, his ethnicity. The texture is smooth, not dry, not flaky. And I'm going to have the patient get up to observe his gait, looking for spasticity, thick streamer. And I'm going to have the patient stand up and close his eye to perform Romberg test to assess his balance. His gait is normal, no evidence of spasticity, thick streamer and or unevenness. And the Romberg test is negative, indicating he has normal balance. And next I'm going to palpate the extremity. And he has normal shape joints and they are symmetrical. There are no sign of arthritis or swelling. And the muscle tone is strong. And while palpating, I'm looking for any masses, tenderness or edema. And I'm going to including the anterior tibial aspect, and he has no edema. And next I'm going to assess his sensation of touch and pain. I'm going to have the patient close his eye, and I'm going to use the cotton ball to test his light touch, and then use the stick to test his pain. Okay, he is able to tell and he is able to feel both light touch and pain sensation. And next I'm going to assess his hand grip strength and symmetry. I'm going to have him squeeze both hands squeeze me symmetrically. They are the same and it was a strong grip. And next I'm going to assess his foot and leg. I'm going to have the patient push on my hand. I'm going to tell him to push the gas pedal down and pull my hand, pull your toes to your nose. Okay, both legs are strong and symmetrical strength. And next I'm going to assess and demonstrate the range of motion on the upper extremity. I would guide through this movement. Okay, you are can you follow my lead? We are going to do supination, pronation, adduction, flexion, extension, circumduction. The patient is able to perform range of motion, full mobility, and without difficulty. Is there anything you need before I leave? No, this is your colleague. Thank you and have a great day. And wash my hand.